Vitiligo is a condition where people get white patches or depigmentation on their body, and it really causes a lot of difficulty with self-esteem and overall functioning. A very difficult to treat condition, but can be treated more effectively nowadays than it was in the past. It is also associated with several autoimmune diseases, which is the poster presentation that we're presenting here at the American Academy of Dermatology. So families probably have a higher risk, but not a lot higher, so it's maybe 8-fold higher, but still if the incidence is around 1%, it's maybe 8%. So it's more frequently found in families. It seems to be present throughout the world. We approximate that around 1% of the world's population has it, but there are different levels of activity in different parts of the world. So it's not a 1% across the world, it averages out. Other cultures have a significant impact on the way people deal with the condition. So certain cultures and subcultures in the United States are devastated by it. They have hard times getting married, they have a hard time finishing school, socialization, ability to get employment seems to be affected by that. It starts often in the teen and years in the 20s. 20s is the first peak, and then you can get vitiligo at any time in your life. And so you can have vitiligo when you're forming your sense of self, and which is really difficult. It can also happen when you're confident and suddenly you feel like you're being stripped of any type of comfort in your appearance. But there's also many people who are very comfortable with vitiligo and it doesn't bother them. But there's many patients who are devastated by it. So it seems to be associated with thyroid disease, which is well known, but our work is kind of trying to give you a number of how often it would happen. It also seems to be more common with alopecia areata, or associated with alopecia areata, psoriasis, lupus, and certain autoimmune neurologic diseases like myasthenia gravis and Guillain-Barré seem to be more common. And so we don't suggest that you screen for those conditions, except for thyroid abnormalities, which just seems to be around 15% based on the different studies. But the other conditions, you have to watch out for them if they have symptoms of those. It's not contagious, and part of the therapy for vitiligo is actually society's therapy. These are wonderful people which you can embrace and you can touch and they can engage in normal activities, and there's nothing that's contagious. But when you see somebody who looks one way in 1 month and 6 months later look different, people are anxious, they're concerned about it. And just like any other skin disease, we have to kind of explain what this condition is to society so that society can accept their family members and their friends who have it. So number one, you should probably screen vitiligo patients about once a year with thyroid abnormalities. That's not it's not a definitive recommendation by any society yet, but given the number of people who develop over 10 years, check a TSH every year. Number two, look at other autoimmune diseases when they have unusual symptoms. Joint pain, fatigue, weakness. Look for those conditions that were listed earlier, specifically thyroid abnormalities, autoimmune lupus conditions, and autoimmune neurologic diseases. And lastly, please don't tell a patient with vitiligo it's not anything to worry about. That may apply to you, but counseling people and accepting them for what's bothering them is critical. And our patient advocacy groups, like the Vitiligo Support International, always emphasize that to us. And don't judge them based upon their ethnicity. I have many light-skinned patients who are very bothered by vitiligo. I have some darker-skinned patients who are not bothered by it. It's really in the eyes of the patient. But can they function? Can they do the normal activities that make life fulfilling? Can they seek employment? Can they complete their education? Can they socialize? Can they find a spouse? Can they have a good relationship with their spouse? Those are all things that we are trying to manage.